We've now had several weeks in which we can start to see how the data emerges. And of course, right now we see continued concerns about the growth of the virus outside of China. What's surprising to you, or what's jumping out to you in terms of the degree that this is spreading, how easily it spreads, as well as things like mortality rates?
Yeah, so the problem that we're seeing now is the extended amounts of transmission that are occurring in countries like Korea, Japan, Singapore. These are countries with good public health systems, good medical institutions, yet they're struggling to be able to control the spread of this virus once it's introduced into those countries. And that is a real concern, because that's telling us that this virus is spreading, if we compare it to SARS outbreak, that it's spreading more efficiently than the SARS virus did back in 2003.
So can you give us just a sense here, though, of how it's spreading? I mean, there were some reports that some of this may have been transmitted through fecal matter in some way or another. Just give us a sense of why it's spreading at all.
Right now, all of the good data suggests that it's being spread via respiratory secretions. So when you cough, droplets of your respiratory secretions will fall on areas, and that's where the virus is, and you can pick that up and expose yourself by coming into contact with that. There's some evidence for it being spread close by to people through the air, and that seems to be the primary way that it's spreading.
What about the severity of this? Because that has been a source of a lot of debate, lots of questions about how accurate death rates and so forth are in China. Some people have speculated that's not that much different than the flu. Others think, oh, this is much more serious. Do you and other researchers feel you're getting a better handle on this question?
Yes, we absolutely are. And the concern that we have is actually with the more milder cases. It's now turning out that there are a lot of infections where individuals either have very little symptoms or they have very mild symptoms, not enough to bring them to a healthcare facility so they can get diagnosed. And again, that's very different from the SARS outbreak in 2003, in which case most people who were infected developed relatively strong figures of symptoms and seeked out health care. So the fact that you can have an infected person who was probably able to spread the virus, but doesn't have severe enough symptoms to report to the medical authorities is a scenario that makes it incredibly difficult to track these patients and to limit them from exposing others to the virus.
So, Professor, what do you make of the response so far? Because, I mean, you talk about how some of this is spread by people being in close proximity and through the respiratory issues. So, I mean, we just had a cruise ship unloaded where there were suspected coronavirus cases. A lot of those people got on planes and went back to their home countries. Are other nations other than China taking this as seriously with regards to keeping people quarantined and making sure that before they're released out into the population that they're free of this virus?
Yeah, so many of the measures that have been tried to control this virus have been the appropriate one. I will say that just because you say quarantine doesn't mean you're doing quarantine effectively. And the cruise ship, I think, was a good example of this. There was spread of this virus apparently among the passengers on the cruise ship. That shouldn't be happening if quarantine is instilled in the appropriate manner. So I think we're rapidly approaching a time when the measures that were initially used to try to control this are going to be shown to not be very effective because of the large number of cases that we see, and we're going to have to take different approaches to try to deal with the outbreak.
Andrew, I want to ask you a question from a professional stance. I mean, there's a lot of questions about the reliability of data that we have, and a lot of questions, of course, about any numbers that come out of China. As a researcher, trying to understand what's going on, how confident are you that you can get access to fairly transparent numbers so that you can do your job?
I think it depends on the source and the country that we're reporting. And I think it's also very difficult. You just commented about how the case description is changing. I think it's also clear that there are different kinds of cases now. As I said, there are mild cases. There are cases that people perhaps aren't getting symptoms at all. And then there are the severe cases and the cases that require hospitalization. So you can see that this is not a very homogeneous. It's not a very straightforward, everybody who gets infected has one set of symptoms. And again, that makes it very, very hard to track and keep count of patients. But we're getting a handle and able to make better estimates now that we know that these kinds